right. Well, welcome to the Nourish Together Gut, Heart, and Mind podcast. I'm super excited to have Dr. Miranda Naylor joining me today. Dr. Miranda is an osteopathic doctor and functional medicine doctor specializing in women's health and fertility. And it's such a treat to have you. Thanks.
Thanks so much for having me.
Yeah, I'm very excited to talk to you about feeding our hormones and feeding fertility and what that
Mhm.
means from a functional medicine perspective. So before we go into the subject of our conversation, I would love it if you could just share a little bit of your own story and journey to becoming a functional naturopathic doctor.
Yeah. So it's actually in my residency training, in family medicine training, in the hospital, in an area that was, low socioeconomic area, a lot of really sick people, and just seeing this, just people coming in all the time with the same things, not getting better, or recommending the same things, more and more medications, and no one was talking about their diet. And meanwhile, I was like, this is a great time for me to start a family. I'm completely stressed out and, not a good time at all. But I was like, I'm 30 now and, this must be a great time. And I came off of birth control and I wasn't getting a period. And I was trying to apply my medical knowledge and didn't have any answers for myself or my patients, as I was seeing, women with PCOS and things. We had very few solutions, and I got a personal taste of it, and it struck me of like, why don't we have more answers for people? Why are we just throwing medications at them, not talking about diet, not talking about lifestyle factors that a lot of people were really motivated to take on, and we just sort of assume that people can't or won't do those things. And not even like even the doctors weren't aware of these things. I was just interested on my own, so I loved it, and I could see this really big disconnect. And I kind of saw the light and was like, this isn't the right way. There has to be a better way. And that's when I learned about functional medicine, and it just made so much sense that we're actually trying to get to the root cause of things. We're trying to understand why things aren't working well and actually support our bodies to have optimal health rather than just not dying, which was great back in the day when medicine was started, when people were, very sick and we wanted to keep people from getting sick and dying. Now, not really enough for most of us. Most of us actually want to feel good. And now that things like fertility or infertility or fertility issues are at an all-time high, so many of us are having these problems that were like the traditional method, the traditional, form of medicine is not working for us anymore. And so that's where functional medicine for me has really been the answer for my own personal journey, and then my ability to better support my patients as well.
Beautiful. What did you find? Is there anything specific about functional medicine? Did you have any aha moments when you were studying it that you went, oh, this makes so much sense? And again, bringing back that food and lifestyle piece that is so
Mhm.
big.
Yeah, I mean, I feel like I had a million and 10 aha moments because it just makes so much sense when you go into, like the biochemistry and these small molecules. And then I always describe it to people like we zoom in so closely to all these little tiny things, and it's really interesting and really fascinating to me of how things work. But then we always zoom out of like, okay, well, what can we do about that? Well, we can eat well. We can eat a variety, lots of color, vegetables, the basics, move our bodies, and that we can see really like close up under the microscope that it also has this big impact on our health. So that I guess that's my biggest aha moment of like these things that were like, oh, it's common sense. Of course I should be sleeping. Of course I should be moving my body. But it's not just, oh yeah, whatever. It has this profound effect that we can see in so many different ways in our body. So I think that's my biggest and most favorite part because we can get in like, okay, all these cool supplements and all these exotic things. But the biggest, most amazing thing about functional medicine to me is that it could be the small, daily, normal things that we're doing that add up to really awesome health and really, optimal fertility, healthy babies, healthy generations, can have this massive effect.
Yes. And keyword there is daily, right? Because everything that we
Hmm.
do, if we're doing it every day, it makes a huge difference. And I
Yeah,
do
the
believe that
consistency.
so
Hmm.
wholeheartedly.
Yeah.
When we think about personalized care, which is one of the differences from functional medicine to traditional sort of Western medicine, is this notion of looking at the whole person. Like you said, you zoom in, but then you also have to zoom out and like, who was the person that's sitting in front of you? And
Hmm.
when you personalize that, is there anything that you find that is really important in that practice of just not taking all the general information? Of course, studies are very important and all of that, but how do you then apply it to the person sitting in front of you?
Yeah, that's a great question because it is so important, right, that we're customizing things to each individual and really looking at the whole person and their environment, like the things that make them who they are. It's really looking just as simple as you said, like looking at the person in front of you, I think is the most important thing. And it's hard to deny when you're talking to someone to then, I mean, and some, not to say that not all doctors can still do this of like, well, the studies say that you should just do this, and they kind of see things black and white. For me personally, when I'm looking at someone in front of me, I can't not apply that something to them because I can't say, well, all the studies show this, but it doesn't seem to actually apply to you, or this is like, just not going to work for you. For me, the person is the most important part of it. And so, even when looking at lab results and things like that, I feel like that's where the art of medicine comes in, where we really have to apply it to them and make it work for them, make, the lifestyle pieces work for them, the nutritional pieces of advice work for them. So yeah, to me, that's the most important thing. Yeah. And it makes it more challenging, of course, because, right, we can't just say like cookie cutter, everyone's the same. Everyone, gets the same medicine, the same treatment. But it's so much more fun to me that I get to figure out, okay, how do we work this puzzle for you? And we really get even better outcomes that way too, because people get what they actually need.
Beautiful. So, speaking of nutritional guidance, right, again, with this caveat that yes, it's very individual to every person, but are there some general things that you feel like you look to or that you recommend when it comes to both hormone balance and fertility? So, I know that for some of the listeners, they may not necessarily be interested in enhancing fertility. They might be past that point where they're actually in perimenopause or menopause and not thinking about having children anymore. But are there things that support both hormone balance and fertility at the same time?
Absolutely, a lot of things. And do you specifically mean nutritional pieces
Yeah, we'll
or
start with
lifestyle
nutrition
also,
and
both?
then we'll
Okay.
go into other
Yeah.
like supplements and lifestyle.
Yeah. So like I was saying, some of the basics can go a long way. So some of the basics that I like to talk to everyone about are they getting enough hydration? Drinking enough water? Is their water filtered? Trying to avoid a lot of, incoming toxins if we can avoid them. Getting enough protein, getting enough fiber, having variety of colors on their plate, and specifically, plant colors. So the natural like colors coming from plants and fruits and vegetables. Those are some of the most important things that I look at when we're starting. And some of the biggest game changers that I'll also see. So many of us, especially busy women, we're not getting enough protein because we're like, we're not bodybuilders, I'm eating enough. And I actually love this conversation. It's a much more popular conversation nowadays on social media and things to be getting enough protein. For myself, I noticed a difference when I was actually paying attention to my protein intake. It's a game changer. And for so many of my patients dealing with hormone abnormalities, dysfunction in their menstrual cycles, rough perimenopause, menopause symptoms, and fertility, growing a healthy baby. It's important for all of us. So that's a really key factor that I look at for pretty much everyone. And then fiber is another piece too, where before I'd kind of think about like, we don't have to talk about fiber until we're constipated and old and whatever. And in reality, so many of us don't get enough fiber because
Right.
we, even if we're not eating a standard American diet, really like poor health, low nutrient diet, we're still, a lot of us are eating more refined foods that don't have enough fiber. And so again, getting a lot of plants, getting like a lot of variety of fiber that can feed our healthy gut microbiome, as well as keep us regulated as far as our bowel movements, because that's such an important detox pathway. So if we're having excess estrogen, for example, it can't go anywhere if we're not pooping. So getting enough fiber to get things moving is super important also.
Yeah, and that's great. I mean, fiber, I feel like in the US, it's really low intake daily is an average of about 12 to 15 grams when we should
Hmm.
be getting a minimum 30 grams.
Hmm.
And, in some of the healthiest traditional cultures, they were getting up to like 70 grams a day, which is a lot. But, there's definitely, I feel like one of the things I would hear and still hear a lot from my patients, like, well, things are going off. I'm not feeling great, or oh, here are my labs, and now I might be pre-diabetic, or other things that are going on. But they're like, but I eat pretty healthy diet, And then we look at like what does healthy mean, and I feel like there's so much confusion around that
Hmm.
because once you actually analyze somebody's diet, even if it's just a 3 day average of what they're eating for 3 days, which is what I do with my clients, we see that like protein is low, fiber is low, and
Hmm.
so what are some, you mentioned, eating all the collars and of course the antioxidants and everything else that comes with those
Hmm.
collars, but usually the colorful foods also are going to have some amazing fiber.
Hmm.
Anything else that you have, like specific foods that you recommend for increasing fiber intake?
Yeah, I mean, of course, vegetables. Like none of us are getting enough veg. I mean, yeah, so many of us aren't getting enough vegetables, so that's a big one. I love again kind of seeing what people like and incorporating it there, or if they can, if they need a little extra boost in things like chia seeds, flax seeds added to things. Kind of trying to see, and I do this kind of with all of those pieces. Where can we fit more in? Okay, where can we fit in a serving of veggies? Where can we fit in a little extra protein, whether it be like collagen peptides or just increasing other protein sources? So same with fiber. Where can we add some nuts and seeds to the yogurt or whatever, so that we can boost it up and get a higher variety also, rather than just sticking to one go-to thing.
Yeah. And if you are working with somebody who's a vegetarian, do you have a particular approach for increasing protein?
Yeah, again, just trying to find the sources that they like and really prioritize those. It definitely is harder when people are vegetarian and vegan, especially when we're working on preconception and fertility, just because getting the right nutrients can be a lot more challenging. And this is coming from me as a past vegetarian and vegan myself, who had to start eating animal proteins for my own fertility. But it's definitely just working with what they're okay with. Like if eggs are on the table, great. If not, okay, what are some other plant sources that we can get? And sometimes we'll go to the more refined protein powders in that context if we need to. I
Mm.
don't love the vegan or plant-based proteins quite as much, but when we just need to get protein in, then work with what we got.
Beautiful. Yeah, same here. And I feel like if you have to, it can be done, but they tend not to taste as good. Their texture is not as good, and they can be harder to digest. But again,
Mhm.
if we're working on overall rebuilding gut, digestion, strengthening, and then being able to work with what's in there, what they're okay with eating.
Mhm.
Absolutely. And how about some of your practices that you suggest people do as far as, I mean, maybe you can talk a little bit about the role of stress, both in fertility and hormone balance, because
Mhm.
a lot of lifestyle practices are going to be around reducing stress, managing stress, finding ways to get the body back into a rest and digest and reproduce mode versus being in fight or
Mhm.
flight. So, can you say a little bit about stress and its role?
Yeah. Yeah, of course, stress is huge and can be a tricky piece, of course, too, especially when people are trying to get pregnant and they're so stressed about that. And everyone's telling them, just relax, it'll happen. And it's like they're stressed about being stressed. And then it's like this ongoing thing. Um, Trying to build in mindfulness and joyful practices is one of the biggest things that I'm trying to support people with. Meaning, okay, do you like meditation? Is that, a good one for you? Journaling, breath work. We have a lot of different mindfulness tools. Bringing in joy is not something that's often talked about, like playing, doing something that you enjoy, dancing, going for walks out in nature, as well as things that are just like grounded. So like nature is awesome. If someone is limited with what they can do physically or time wise, just trying to incorporate some things in, like we're talking about, in their daily life so that it's bringing them down to a more rest and digest and reproduce state, trying to shift out of the fight or flight as much as possible. And I'm also, especially post pandemic, I'm talking with people a lot about nervous system regulation, which is sort of a step beyond just relax and everything. It's sort of like having to reset our brain a little bit to more be able to be in the rest digest state. So many of us got wired in a very stressed out state, and that can become, I don't want to say permanent, but like a little more hard, where it's really hard to get out of fight or flight, no matter how much relaxing we're trying to do. And so using some other tools too to really even be very, very specific with our brain chemistry and our brain wiring to really, be able to shift back into the parasympathetic, which is that rest, digest, reproduce state.
I'm so glad that you brought up the nervous system kind of resetting and post COVID, because that is so important, I think, for some of us or people that have dealt with a lot of trauma or a lot of loss, that there is a tendency of getting kind of stuck in that place, and that it takes real effort and real practices like breathing practices, maybe working with, acupuncture and a lot of external um, um, modalities, but complementary. That's the word I was looking for. But complementary modalities that are all kind of targeting nervous system regulation, chiropractic care. I mean, there's so many different ways that sometimes if we're just like going for a walk in nature and trying to do it ourselves might not give us the full benefit of actually getting that deeper reset. Are there any modalities that are specific you really love recommending?
Yeah, the ones you mentioned, I agree, are great options. I also will often recommend things like, I call them amygdala retraining or limbic system retraining programs. There are a few out there now, like the Gupta program is one of them that I love. DNRS, EMDR, which is done with a therapist when people really need more one-on-one support. Brain spotting is another one that's similar to EMDR. There's the Safe and Sound protocol, which is another awesome one that's great for kids and adults, where you're just listening to music and it's in a certain frequency so that it's actually giving your brain the signal without you having to really do anything or think about it. You're just listening to quiet music.
And can you say that name again?
Yeah, it's called the Safe and Sound protocol.
Safe and Sound protocol.
And there are different practitioners that, will have it as a tool in their practice. And yeah, that's another great tool. And oftentimes either we need to find one that's a really good fit for us with our schedule, with what we're open to doing, or having a few tools that we can really incorporate into our daily life, our week, so that we're giving our brain all of the messages, right, to relax, feel safe again, and then be able to then just do the regular relaxing again, get back to that higher resilience state.
Wonderful. In your experience, do you feel like, is there particular, either from the food portion or the lifestyle and these practices that are specifically, we're talking about the stress here, but maybe there are other practices that you might want to talk about too. And talk about joy, which I think is so important to bring back, because especially on a fertility journey, or actually even with hormone regulation as you're in perimenopause and menopause, the notion of joy is so important, because we can get so stuck in like, I need to do this, I need to do that. And then it causes more stress to just, having to work out or having to eat a certain way or having to. And so I'm wondering, with all these practices and foods, is there anything that you see people really have a hard time implementing, or that they reject more often than others? Or do you find that with your experience with your patients, it's an easy integration?
It's a great question. people definitely struggle with the lifestyle pieces and the diet piece. Like you mentioned before, knowing what a healthy diet is can be hard. There's so many different conflicting opinions out there, and some people are really indoctrinated with certain things. Like, no, I've been eating a healthy diet like this, and sometimes it can be very hard to shift out of that. Um, Sometimes, yeah, getting the lifestyle pieces in, actually incorporating stress relief practices or being able to take things off their plate. Some people really just have a hard time, like, seeing that their job is a really big source and maybe they don't have to be doing that anymore. Um, Sleep is another really important one for, hormones, fertility, all of it again. Um, and that one can be challenging, especially when people are really struggling with sleep. That can be a challenging one. Not that they're not trying really hard, but that one, a lot of little practices have to play in so that they can sleep better. Relaxing nighttime routine, having it dark and cold, all of those pieces. So that can be a really challenging one. Movement is maybe easier. I mean, people are in the mindset that we have to punish ourselves to have a good workout. So maybe that's one piece. There's a little bit of undoing. I'm usually talking to people about scaling back a little bit. Like, no, especially even if they're worried about weight, you don't have to necessarily be doing more and killing yourself and being more in pain. What you might actually need to do is scale back a little bit because you're exhausted and your system is just, taking this all in as stress, not a beneficial stress. So that can be a challenging piece too. Just sort of changing their idea of what the right thing for them is and helping them tune into what their body actually needs, kind of tapping into their own intuition. And again, people aren't necessarily like not trying to do that, but we're just not trained to do that. We're kind of trained not to listen to our body. Like, pain is gain, or no pain, no gain. If you're tired, drink more coffee. It's sort of like this idea of don't listen to your body and just keep on going. And so that's one of the hardest things that I like talking again, especially with all my female patients, because we're cyclical humans. We're not the same every single day. And so tapping into that so that we can best support ourselves. Yeah.
Yeah, wonderful. And as far as sleep goes, is there anything that, especially for women, and I'm just going to shift from the fertility to the perimenopause, menopause here for a moment, because I know that sleep can be really affected by those hormonal changes, and people do struggle. So do you have a set, like you said, it's many little things that we need to do to help, and you already mentioned having a cool, dark environment and having a relaxing sort of routine for bedtime. Is there anything else you would add to that for somebody who is struggling, that is in that sort of hormonal shift time with peri and menopause?
Mm-hmm. Yeah, a few more things. One is daytime sunlight. So getting sunlight first thing in the morning, or as soon as we wake up as best that we can, or maybe using a light if we're in an area where we're just not getting a lot of great sunlight in the morning. That can be really helpful. It's not, I kind of see it as a balance, almost like a yin yang of daytime versus nighttime. Our hormones are similar, cortisol versus our melatonin. And so trying to give our body the stimulus of, this is daytime, this is when we're supposed to be awake, this is nighttime, this is when we're supposed to be asleep. The same thing can be throughout the day. Sometimes we're feeling exhausted in the morning, wired and tired at night. And so having to kind of switch our cortisol pattern. And so, yeah, the relaxing things, the teas and the supplements and stuff like that can be really helpful in the evening also. And then with nighttime waking, especially during perimenopause and menopause, of course, a lot of it is hormonal. But I also like to look at blood sugar regulation as well as toxin burden for those. Because sometimes our body is bottoming out in blood sugar overnight, and that's what's giving us a cortisol spike and making us wake up. Another thing could be we're detoxing and our body is doing what it's designed to do, but it's doing it kind of at wrong times. And it's like overnight, it's waking us up because we're just, overloaded and our body's struggling a little bit to detox. So I'd like to look at those pieces too. Say, okay, maybe we can improve those things and see the symptoms change. And it can really help too with like hot flashes, night sweats as well. That those pieces, the stress reduction and the daytime things can absolutely have a really positive impact on the nighttime things too. So yeah.
Yeah, great. Yeah, and detoxing is so huge. So I know that on your website right now, which we're going to tell everybody about, there is a guide for preconception detox. And is that something, can that be used as also a perimenopause detox, or do you think they should be different things for different reasons?
No, absolutely. It's a really great starter point for anyone to check in with. And really the design of it is, where can we reduce our current toxin exposure? Like, where are areas where we may want to look? And then how can we support our body in naturally detoxing? Sometimes we have to go beyond this, of course. Like, we're, completely toxic in mercury, something like that. Obviously, we'll bring out some bigger guns at that point. But some of the basics, again, can go a really long way here. And so just checking in with, okay, is our water clean? Is our air clean? Are we bringing in extra toxins into our house without us knowing? Things like that. It's great to check in with. And then, yeah, be able to support our body in naturally detoxing. Some of the things we were talking about, like drinking enough water so we're staying hydrated, making sure we're pooping well, so that's like a huge detox pathway. Supporting our liver with, bitter vegetables, a variety of fibers, cruciferous vegetables, all those things. So yeah, it could be good for anyone, male, female, any age. Yeah, it's still
Great.
helpful.
So tell us your website and how to find you and connect with you in various platforms.
Yeah. So my website is drmirandanaylor.com. That's drmirandanaylor.com. I'm on Instagram and Facebook at Dr. Miranda Naylor. So keep it simple. It's all the same. Yeah. And I have the preconception detox guide on my website, as well as a fertility lab guide, which could also be, again, used for a lot of other people to start to check in with what labs they could start getting to reveal a little bit of a deeper look into their health, as well as the optimal ranges to look for, rather than the normal, very broad ranges. So those are a couple free guides there. Yeah.
Wonderful. Well, thank you so much. This was so informative, and I just love, I met Dr. Miranda last year in person at a conference, and was very excited to have this conversation with her. And partly, I just really love your energy and the way that you present and you talk, and you make everything very accessible. And there's just a kindness that comes through you. That's lovely. So thank you so much.
Right back at you. Thank you so much. Yeah, I know. I remember when we met and we're like, it's one of those like vibes. We're like, oh, hi. Like, we're similar people here. We got a good vibe going. So yeah, it was so nice talking with you always.